Amazing. Hi. I hope you guys can hear me okay. I hope my audio is fine. Welcome, everybody. Welcome to today's live stream. Really glad to have you join me today. In this session, we'll be discussing questions that you've sent into the channel over on YouTube in the last 1 week. And if you guys are enjoying these Q&A sessions, I think they're my format for the year. Or if you find the information that I'm sharing useful, please click the like button. Please leave your thoughts in the comments. Always very welcome if they're respectful, related to the issues that we're talking about. And of course, subscribe to stay updated on the different platforms. So welcome guys on YouTube, LinkedIn, Facebook, and on TikTok. How are you guys doing? Hello. I would also encourage you to check out the description box. I'm going to put it in the different platforms when I've finished, but on YouTube, you'll find a link to the website, and on the website you can join our mailing list for a monthly newsletter that's packed with helpful health tips. Use our free symptom checker use our free symptom checker for guidance on any health concerns. And of course, you can send an email inquiry or question for a customized response from me or one of our expert clinicians, and that's on the Ask Away Health website. So let's just dive straight into today's question. We've got a few let's dive into today's session. We've got a few questions to go through. And as usual, before I start, I'm going to put up the disclaimer. We're having a conversation here around different health issues. And while the purpose of the conversation is to provide health information, I cannot specifically give anybody a diagnosis. I always encourage us to please go back, speak to your own medical practitioner who has access to your detailed medical records, can carry out a physical examination and other tests that you need. So really important here to share health information, help us sort of, understand better, think things out, and probably provide some direction, signpost you to go back and speak with your doctor and ask about different things so that you're well educated about what's going on in your bodies. So I'm going to put up the first question for you guys on YouTube, LinkedIn, and Facebook, because it's a rather lengthy one. I couldn't get it to fit on the banner here, but let me read it out so that you guys on TikTok also have the opportunity to understand. And I will come and say hi to people on in a minute. It's just that I want to make sure we get through the questions, get into things quite quickly. So this says from somebody who was on the channel last week, and this is in response to the video I showed or I published on womb thickening, also known as endometrial hyperplasia. So it says, hi, Dr. Sylvia, I'm a 33-year-old female. I've had these issues since I was 29. I've only got it checked out about a year ago. And in the last 3 months, I found out the polyp in my womb was pre-cancer. And due to my history of no periods for over 2 years, an irregular cycle, heavy cycle and bleeding, etc., I was offered a hysterectomy because I'm at risk of cancer, they said. I decided I didn't want kids at 30, and everywhere I turn, everyone tells me to wait and the right one will come, etc. Other than those thoughts and mother crying to me not to get it removed, if it's up to me, I'd get it removed, she says. I want to live a healthy, long life to be there for my nieces and family. What do you advise? I'm scared of surgery. This will be my first ever major one. That's why I'm hesitant. Guys, I'm going to leave it up on the screen for a little while because there's a lot in this question, and I'm really grateful. Thank you so much to the person who sent it in. Of course, I've kept it confidential, but thank you so much for sharing this question. I think that there's such a lot, is a complex and sounds like a really emotional roller coaster that this lady is on. And I just want to say that many women face complex decisions just like yours when it comes to major surgery like hysterectomy, and particularly when there's a risk of cancer. So there are lots of emotions that can come up, not just for you or not for the lady, but also for your loved ones. And it's important, to consider all that, although balancing your own health and the needs of others around you who love you and their feelings is not easy. It's not easy. Like I said, I can't specifically say, here's what to do. And I so much empathize with you. I can't tell you directly which way to go. And I can't say to you, here's what to do, here's the way to travel. I don't think anybody really can do that for you. It is your own decision. But of course, I respect the fact that it's helpful to hear other people's opinions, and just get as much information from everywhere you can before you make this really, really important decision. And it's good that you've thought it through long and hard. You're confident in your decision. It's okay to prioritize your own health and your well-being now and in the future. And there are different tools and different things that we could do, which I'm going to talk about in a moment. But specifically to the person who sent in this question, there are different tools that you can use. And yes, I mean things like egg freezing or adoption, other ways that you could have a child that may give you peace of mind. Especially if down the line you feel, okay, you do want your own child, and it's not, you want more than being, really close to your relatives' children, like your nieces, for example. And it's perfectly normal to feel scared and apprehensive, anxious about surgery, especially the first time. That's perfectly normal. And I would say talking openly about your doctor, your medical team, about what to expect, and maybe speaking to others who might have gone through the same or something similar, I think could also help to ease your mind. I think the only people who can really weigh in very strongly on this, of course, you are critical, but of course, your your specialist, your medical team, and maybe a few really close people around you are the ones that are key to sort of weigh in and help to make this decision. And I do trust you. I do trust you. I don't want you to feel as if you have no power in this. I think that you have power, and part of the power is your body, and part of what increases your power is information and knowing what to expect and so on. All right, so guys, we've had let me just put it up on the screen again. I'm not going to read it. It's a very long story, but okay, guys, just joining on TikTok, since you don't have access to the to read it. We have a 33-year-old lady who's had issues with irregular periods and heavy cycles going on for about 4 years. And then in the last 3 months, found out that there's a precancerous polyp in the womb. And her doctors have offered a hysterectomy because of the cancer risk. But and while she actually doesn't mind the hysterectomy, because she said she doesn't want kids, she made that decision 3 years ago. So independent of any diagnosis, she had come to a conclusion. We don't know how that came about. We don't know what that was about, but she came to that conclusion that she didn't want kids 3 years ago. However, friends and family, those around her, say, oh, don't be in a haste to make the decision. The right guy may come along and you change your mind. And of course, mom is devastated, hearing this scare of cancer, worried about not having kids. Mom is encouraging her not to have it removed, although she says she won't have it removed. She wants to live a healthy, long life. So she's telling us her goals. Her goals are that she wants to live a healthy, long life. And by all means, she's certainly entitled to this. And I think that's important in that decision that she wants to make. Plus, she says she wants to be there for her nieces and family. And then she's saying what's the advice. And she mentions her concerns about surgery. So this is the issue that we want to tackle with. Before I sort of go in and sort of give my thoughts, and of course, you guys are welcome to put in your own thoughts as well. If you've experienced something similar, you want to share how you went through making that decision, please feel free to pop it in the comments. You guys know that that's always welcome. And can I just request, please, at this point, for you guys to give this video a like, and of course, like I mentioned earlier, subscribe to the channel. That really, really helps us. So there are lots and lots of issues to consider here. So medically, for example, there's a risk of this cancer that was diagnosed about 3 months ago, and the cancer spreading or progressing, not is the right word, progressing. So they said it's a precancerous polyp, which is like a growth within the womb. And that in combination with no periods, irregular cycle, heavy bleeding, it suggests a few things that we are not aware of, but there is a possibility of other underlying health issues. And I believe that her clinicians, who are in better knowledge of this than we are, have recommended the hysterectomy based on a high cancer risk assessment, obviously because they have information that we don't have. And, the impact of not having periods for over 2 years, what are the issues? Perhaps a diagnosis of polycystic ovary, other hormone imbalance, or just related to endometrial womb, the lining of the womb being abnormal, being thickened, as she did say. That was in response to this video which I shared, and all that. As if you watch that video, one of the things I talked about in terms of the complications is the possibility of an increased cancer risk with increased womb lining thickness or a thickened womb lining. So those are the things that are in the mix, and of course her concerns about going into surgery, being afraid of complications to surgery, infections, bleeding, anesthetic complications, all very valid concerns, especially if it's your first time on the whole story. But then again, hysterectomies, and of course it depends on which part of the world, and I don't know where this comment came from. It's a fairly common procedure today. And one of the important things before going into this is making sure that you're working with a practitioner, a specialist that you can trust. So one of the things that I would say is, looking at, yes, it's good to investigate where they're going to look after you, what's your aftercare going to be like, what kind of anesthesia, have a conversation with the team to be clear, because the more information, then you sort of feel more confident about it. Now, compared to maybe 10, 20 years ago, we have a lot more information. Even here on YouTube, for example, people sharing information about hysterectomies, what to expect, and how the procedure goes. So again, I would encourage getting a lot of information around that. This next bit, I'm sort of sitting on the fence. And again, I am not your primary medical practitioner, not taking over their role. I'm just sort of helping to provide some context and perhaps a bit more information. But depends on the degree of the cancer. Although I feel that this is something that they would have had a conversation about. They would have thought about just removing the polyp alone, using a procedure called hysteroscopy, where they use a tube with a camera at the end, go into the womb. They can see the inner lining of the womb. They can scrape away any abnormal tissue and they can remove the polyp. They would have considered that, but perhaps it's felt that is not right for this particular stage. I don't know. We don't know. D&C, again, procedure to scrape the lining of the womb. They may have considered all that and felt it is not the right way, especially if there's a high risk of cancer. But again, just to make sure that all the options are covered, all the boxes are ticked, I strongly suspect that they will say no, those routes are not going to be enough, because it probably will not address, the type of condition that they're dealing with. So, that's the first issue, I think, that's really important here. And that issue is around the medical concerns, the medical issue, how she got here, just based on the information that she's provided to us, which I think is quite a lot, about where she is. I think those are the key medical considerations. So I would like to move on in a moment to the next consideration, which she also shared with us, and that's the emotional. I hope you guys can hear me okay. I didn't do a sound check. Nobody has said in the comments that they can't hear, which I suppose is a good thing. But if you can't, please let me know. Let me know in the comments that you can't hear me. And if you're just joining, thank you so much for watching. Appreciate that. Give the video a like I said. So what else is an issue? What else should you be considering in this kind of thing? I think the very next important issue is the emotional and social concerns. This is a lot. This is a lot for somebody in their early 30s, to take on board. Even though she said she made up her mind 3 years ago that she didn't want kids, to an extent, we don't know what brought that on. We are all human beings and we can react differently. Perhaps there was an experience that made her feel that way. It may be the issues that she's had with her periods. And, people around you are probably trying to do the best they can to say, well, don't make that decision yet. You don't know what the future is. You might change your mind. It's a natural reaction. You guys, it's a natural reaction. We will say the same. Let's be honest. If we were sort of the friend or relative here and you want to see somebody go on to have a family and so on. So it's a natural reaction. And sometimes we don't know when we are putting too much pressure on somebody when they have to make a really important decision. I want to acknowledge that. And I want us also to think about, how we would react, how we would take this thing if we were ourselves sort of in her position. So It's common for us to project our own desires, our own cultural beliefs around motherhood. Majority of people would feel, oh, motherhood is the next step. It's natural. It's this. But there's some people who do not want, and we have to respect that. There's some people who this is what they don't want, and really it's good not to push people to do things that they don't want to do. I think it's really important to recognize our limits and not push people beyond what they want. Or you can give counsel, but know when to step back, know when to say, okay, I've given advice, and let somebody make their own decision. She's an adult, okay? So yeah, it's natural that people could project their desires, and they mean well, but it may be that they're not taking into account her own preference. So I think what's really important is about having clear boundaries with friends, close friends or family, and have, really close family like your mom, really have open, honest conversations, open, they may be painful, but open conversations that you appreciate their concern, appreciate how they feel, but this is a decision that you've made, if you decide to go ahead with the hysterectomy, have those conversations. Don't be afraid to do that, because I really think it's important. And, most people that are being reasonable will respect and support. Okay, especially, and I love what you said, that your health and well-being must come first. I love what you said then, and I think that's so important. I'm just trying to pull up your just trying to pull it up here. She says, I want to live a healthy, long life, to be there for my nieces and family. And I love the statement of that goal. It's a desire, it's a wish, and it should be, it should be respected. We shouldn't disregard it. I also think, and playing, if you like, quote unquote, devil's advocate here. Even if you do decide not to have children, having that surgery that removes the possibility forever. Let's be practical, because that's what a hysterectomy is. That's it. Once that's done, it's not possible biologically, as it is today, as I speak, to be able to have your own child. And expect that might bring certain emotions to you. And I'm speaking to the lady who wrote in asking for information and guidance around this issue. So please expect that. You might feel that you've lost something. You might grieve, not just lost the womb or, lost time or whatever, but you might feel that you've lost an opportunity or lost a chance to be a biological mom. So that might happen. There might be, time, you might need time to grieve. You might even need counseling about that. I think it's really important to be aware that these emotions can develop, and they are natural, and with the help of or support of family or a therapist or counseling, you can process the emotions. And I was going to talk about something else which I felt was really important, because there are options. If you go down this road, you've come to terms with the fact that hysterectomy is the way you have to go. This is what's happened in your life, but you want to go on and grab life with both hands. And here is an opportunity that medicine is giving, which says, have this hysterectomy. What are the other options for having a family without biological children? Yes, I respect the fact that you don't want to have kids now. You're fully interested in investing in the the life of the young ones around you, nieces, nephews, and so on. Egg freezing is an option. So something to think about, if that's an option that's available to you in different ways, both in terms of access, geographically, financially, and so on. If you have intact ovaries that are healthy, again, this is a conversation to have with your doctor. I don't know the medical condition that you have, and so I don't know what extent or effect it might have on the ovaries. But if it's possible, then perhaps it's something to have a conversation about. If your ovaries are working well and your hormone levels support it, then it may be that egg freezing is an option. Another option, of course, is surrogacy, either using your own frozen eggs or using a donor eggs, and that could be explored later on when you're sort of settled and in the mindset for that. Of course, there is adoption, which provides another really impactful way to build a family without any biological ties. And again, I know that is something that is cultural, but again, we're sort of thinking about all the possible options. We're not trying to box ourselves in. It is an option. Of course, related to that is fostering. So you might want to go into that. You might want to, again, show love. You might want to invest in a child's life, in another individual's life by doing that. And those are other ways that you can think of being involved. So how do you cope with this? How do you cope with the hesitation about surgery? And I think that's really important. I've mentioned a little bit about it before. Try and understand exactly what you're going to do. Talk to your doctor, your gynecologist, your surgeon. What exactly is going to happen, what to expect beforehand, during, and after. And that, just knowing the steps that they're going to take, knowing what the anesthetist is going to be doing, your nurse care, your nurse practitioners, and so on, knowing what they're going to be doing, that can help to reduce anxiety. I just picked a message. Okay, that's fine. I'll deal with that later. Having pre-surgery consultations, helps you to address issues like recovery. Of course, they'll do all the clinical things, check that your allergies, check what medicines would be suitable for you, and so on. But, having a conversation about what life will be like, what to expect after hysterectomy, what might happen to, different parts of your body. These are conversations to have with your practitioner. And, guys, I'm the fan of the second opinion. So if you haven't, get a second opinion. If you're still unsure, if you think, are they sure of what they're talking about? Could there be a mistake? Please get a second opinion, okay? That can either reevaluate your entire medical history, consider alternative diagnosis, because it is a big step. So if that is in your remit, if you're able to do that and see a different practitioner all over and have some tests again, for some people it's possible, for some it's not, but it's something to think about. And I think another way to sort of deal with the anxiety about surgery is look at the benefits, look at the pros, look at what are you going to gain out after the operation, after the procedure? What is it that life has to offer afterwards? Because once we tick all the boxes and ensure that it's done in the safest way possible, minimize complications, then you're free of this cancer risk. You're free of issues around heavy cycles and irregular periods and whatever else was involved in this. So that's something to think about instead of focusing on the negative. So you can sort of make a list, if you like, and think about the pros and cons and focus on the pros after examining the cons and having conversation with experts about how to mitigate or minimize the cons. And I mentioned earlier about talking to people who have had this similar presentations or undergone this type of surgeries. And if you're really, really, worried, if you're really anxious about this, please, get counseling, speak to a therapist. That would be most useful. So these are my thoughts around this particular question. I think it's really important. Thank you so much to guys liking the video. I really appreciate it. I've not really said hi to people on TikTok yet. I wanted to just tackle this first question without any interruptions. Let me know what you guys think. If you're watching this on the replay as well, I've shared the concern. Let me just put it up on the screen one more time. I've shared the concern. I've shared the worry that these questions brought to us. What do you guys think? What do you think about my suggestions? Have you had a similar experience? And how did you work around it? It might not have been the same thing exactly. Maybe a big decision you had to take and family were weighing in and, maybe not necessarily creating an obstruction, but creating a bit of a challenge with how do I move forward when everybody around me doesn't seem to be saying the same. Who's right? Who's wrong? What do I do? Guys, let us know in the comment section. I'm going to take a quick break for you guys on YouTube, Facebook, LinkedIn. And when we come back, we shall go on to the next question. Please give this video a like and, of course, subscribe to the channel. I'll be back in a second. Let's get back onto the session. So let's go to question 2, okay? And question 2 is, I think it's one of the simple ones. Let me see. I think that was okay. So this one, well, when I say simple, I mean I didn't have to put it on a separate screen. That's how simple it was. It was just a few words. So you're welcome if you're just joining the live. And by the way, this live should have held yesterday. yesterday evening, but I couldn't make it. And of course, for some of you on my channel on YouTube, because I only sort of shared it there, it was my birthday yesterday. And I honestly thought that I was going to be able to come on live. That was my plan. I did plan I was going to come on live at 7:30, but things happened. And yeah, things happened. But thank you so much to everyone. I had a lovely day, and so many people sent in lovely, kind comments and well wishes. And thank you so much. I know I have an amazing community. I really appreciate you guys over on TikTok, Facebook, LinkedIn, YouTube. Thank you so very much. I had an amazing day, and I really appreciate your support for what we're doing. It was lovely. So I thought, okay, since I didn't do it yesterday, let's push it to this morning, because I didn't want to miss the weekly live streams that we have. Right, so we're on the second question. We're talking about women's health questions, and I'm doing this every week. I think that's the plan. I would love to be able to address some of the questions, because I do get quite a number of questions onto the channel on YouTube, and I can't address all of them, but I do try to address as many of them as I can on the comments on the video in YouTube. But I get a few of them, I bring them here so we can have a conversation on live. And like I said at the beginning, I can't give specific advice to anybody. I can help provide direction, guidance. And that's important to say, because I'm not your licensed medical practitioner, and it's important that you're speaking to somebody with whom you're registered. They've got your medical background, they've got all your health information, and they're able to provide you the information that's necessary. Okay, with all that said, what a big mouthful. With all that said, let's tackle the second question. It's about pelvic pain, and it was in response to one of the videos that I did on pelvic pain some time ago. And this was from a parent or a carer, and they said, why does it happen in an 11-year-old? Please help. And it's a simple question, like I said, because it's quite short, but it's really important, because when you have an 11-year-old, and I presume that we're talking about a female, because you could have different causes from men and women for pelvic pain, the difference mainly because, of course, of the different organs that we have in the pelvis for the male and female. So let me just sort of focus here in terms of women's health, which is what we're talking about. And this carer or parent wanted to know what's going on, or what could make it happen in an 11-year-old. So of course, clearly very concerning. And I want to presume that this may be something that's been going on for a while, so not necessarily new. And perhaps they've done the usual thing, a bit of paracetamol or Calpol, hot water bottle, and so on, but it's creating problems. I think it's really important to say from the offset, it needs careful attention. It's not something to just assume, especially after it's happened 1 or 2 times, or it's going on, or it's causing real distress and they're not able to function, because 11-year-olds should be out and about doing their business, busy, playing, doing their sports and PE and everything else. They shouldn't be sat at home, on the bed with a hot water bottle, or not able to function. So you really need to bring this to the attention of a doctor quickly, and not wait and see if it will get better. But there's some things that are probably fairly straightforward that might explain it, and others not so simple. The bottom line is that it's important to look into it. It could be as a result of development, so it might be something to do with muscular skeletal growth. It's possible. It may be that as puberty has come into play, because this is the age for many kids. It may be that hormones are causing some kind of disruption or imbalance, and that is the age where you would have it with puberty. It might just be affecting muscle tissue around the area and causing the discomfort. It may be, or it may be serious medical issues that need urgent attention. So I'm just going to go straight into the possible causes, because there isn't much information. I can't really sort of start guessing. I don't know. I just don't know. All we know is 11-year-old, likely young girl experiencing pelvic pain. We don't know how long for. We don't know what other things are going on. But like I said, really important to get into, get to see a doctor about them. So of course, starting the periods early, and experiencing painful periods. So is it possible for 11-year-olds to have periods? Yes, I do get some of them. Randomly sometimes. I've done videos on menstrual bleeding and menstrual cycle. I think the most recent one was on my video around blood in my urine around my period. Something that, most of us older adults don't really take don't really think too much, and I can't remember why. When I did those series, or when I did that video series, I was just thinking about my daughter and thinking of the kind of things that she would ask. And so I did a few videos around your first period and some things that might happen. And I've got a couple of sort of that age group that come to ask questions, and they need information as much as we do, and can only hope that they have older carers or moms, adults that will take on board their concerns and help to explore. So periods, painful period pain could explain this pelvic pain that they're experiencing. So it might be something that they're getting regularly or irregularly every few weeks around the time of the period. That might be it. So that's dysmenorrhea, experiencing painful periods. Of course, it could also be something like a urinary tract infection, which would be relatively more acute. So it's not something that will be happening every other month or every 2 or 3 months, or it wouldn't have that kind of chronic nature. It wouldn't be a long-term thing. If somebody has a urinary tract infection, at least one, I would expect that the symptoms may build up over a few hours into days and then cause an acute problem, and then that should hopefully take them in to see their doctor. The other thing I would say would be sometimes it keeps coming and going. So some people might be a very light bladder infection, cystitis, and then with time, drinking plenty of water, it flushes out some of the germs out of the bladder, but not completely. So the rest in there start multiplying again, and then after a few weeks, again the same problem. Maybe the person's immune system is able to handle some of it and it goes away, and then some of the germs are flushed away, but then the rest multiply again, and then the problem recurs after another few weeks. I mean, I'm sort of speaking about a very imaginary situation, but I'm trying to explain why it could keep coming back, so that we don't see an acute presentation of 2 or 3 days problem, but we see something that's been going on for 5, 6 weeks. And when you think, oh, why is it coming back? It may be because when it first happened, it was sort of very light and low grade, and then it comes back again and it comes back again. So it might be a urinary tract infection, like a bladder infection, that's causing the pelvic pain. And other things that you might find with that might be painful urination, it might be a fever, and that's why I said it's more acute. A fever, maybe vomiting, pain around the pelvis and the back, smelly wee, those are the sort of different things that you might experience with that. Of course, it could also be not bladder problems now, not problems related to the womb, but it could be something to do with the stomach, the bowel. What about constipation? Okay, constipation, if somebody doesn't have a bowel habit that is regular, that allows them to ease or empty the bowels regularly, that might be the reason for the problem. Or it could even be, again, this is acute, something like an inflamed appendix or appendicitis. And when we think about appendicitis, we expect it to be, this earth-shattering pain that causes problems, and everything drops. Yeah, there's some people who get that really severe pain. Some people, it's not so straightforward. You may not get the classic symptoms of the appendicitis, pain on the right side of the lower abdomen or pelvis, the vomiting, fever, not able to walk upright. You may not get that. You may get something that's a little less severe, but it still is an inflamed appendix. Tends to be a lot more acute, but it's really important that, in that second scenario I just described, it tends to be a lot less acute, but still important to get it checked out, because you don't know, you don't want to assume. I talked about earlier about muscular problems, even trouble with the hip. So, they're playing in school or PE or something, they've got an inflammation of the hip, and it may not just be from an injury or trauma. There could be other causes that lead to arthritis of the hip, of the joint, and that could sometimes refer towards the pelvis. And the problem isn't just in the pelvis, is also in the hip, and maybe what they're describing is something that started with the hip, although they just say, oh, it hurts here, and you might think it's pelvic pain. Actually, it's a hip joint problem. I mean, we could sort of spend time talking about the possible causes. Of course, there could be things that somebody is born with. It may be that the way the person's, so these are sort of congenital problems that were there before, because remember, we don't have any background information. And I'm just thinking very widely. What if this is somebody who had some congenital problem, perhaps with the hip joint or with some other parts of the body, and it's flaring up at this time? We don't know. So we put it on the list of possible causes. It's unlikely to happen. It's quite rare. But what about things like an ovarian cyst? I mean, if it was an older lady who came in and we're thinking about what's causing her pelvic pain, for somebody who's already sexually active, of course, we'll be going into ectopic pregnancy and ovarian cyst and all that. Less likely here, clearly, in terms of pregnancy. But what about things like an ovarian cyst that is swollen or just getting bigger, and sometimes it twists around itself, and then, could cause something the organ to burst or the cyst to burst and so on. So different possibilities. Important to speak to a doctor under the guidance of a parent or guardian or carer, and a health professional who is a specialist in this area. Okay, and really important to do so promptly. And I think I answered this to the person who asked this question online, because I didn't want them to waste any time. I wanted them to go and seek medical attention. So that's in response to the second question that we're tackling today on pelvic pain. Why does it happen in an 11-year-old? You will get some similar reasons for why it happens in an adult, but you would also get some reasons for why it's specific to a child or a minor. And it's really important to get them urgent medical attention, especially if it's very severe, causing them really significant distress, carrying on for longer than maybe a couple of days, or it's recurring, it's just not getting better. Please don't sit on it. Get them medical attention. Okay, I think it's time for another quick break. Guys, let me know if you have any questions. People watching on Facebook, on YouTube, on LinkedIn, let me know if you're finding this useful. If you are, please give this video a like. That would always be appreciated. Let me just take off this banner because we've done with this question. Yeah, and of course, if you guys have any input or you have any comments you wanted to add on this or my response or on the question itself, please let me know. Hi to guys on TikTok. Thank you so much for watching. Appreciate you guys. I appreciate the support. Thank you so much for showing it. Just going to go on to the very next one, but I'm going to, let's just take a quick break and I'll be back with you guys in a jiffy. Hi. Oh, where's the lighting? I'm looking so. Come on. There's the light. That's better. Okay, that's better. Right. So we are talking about women's health questions. Let us go on to number 3. Question number 3 for a meeting today. I'm going to read it out for guys on TikTok. This is a fibroids inquiry, or a fibroids question. On the face of it, I thought it was fairly straightforward, but I just thought it provides a bit of a learning opportunity. So again, I'd love to hear what you guys think as well. And yeah, drop your thoughts in the comments. So this question is, or this comment, it's a question. 2 years ago, I had only one fibroid, which was 1 centimeter in size. After 6 months, they became 2. And the size became 4.7 centimeter and 1 centimeter. Those are the 2 fibroids. Now, after 2 years, I have 4 fibroids, and the size of one of them is 5 centimeter, and the size of the other is 2 and 1 centimeter. But they are outside the womb. So what can I do? I've been trying to conceive for 3 years. Okay, so it's fibroid inquiry. I hope my guys on TikTok heard that. So the situation that we have here is 2 years fibroid. I don't know how old they are. Okay, so this is all the information that I have. Don't know how old they are. Of course, we know that fibroids are benign growths, tend to start developing or to develop more commonly in a woman's reproductive or childbearing age onwards. Okay, so pretty rare in teens, adolescents, pretty rare. But as the woman gets into her mature childbearing age, so we're talking about from late 20s upwards, when it's more commonly happening. I'm not saying it can't happen in younger than 20, but it's rarer. You have it more common sort of in the mid 30s. Okay, so I started 2 years ago. She had just the one. It was very small at 1 centimeter. Then after 6 months, it became 2, and the size became 4.7 centimeters and 1 centimeter. Fibroids can grow at varying rates. Some can grow very slowly or not at all, while others can just sort of, just grow. And then after 2 years, where she is now is in a situation where she has 4 fibroids. One of them is 5 centimeters. The other one is 2, and the other one is 1. She said 4. I don't know what the other last one is. Maybe it's smaller. Maybe it's the smallest. But they're outside the uterus. What can I do? I've been trying to conceive for 3 years. So let me just take that off. I've got a few images to share. So let me just share the first one here. So guys on TikTok, what I'm sharing with everybody else is a graphic. So if you really want to learn more about this, please come and check out my video on YouTube later on. I have the graphics here. Oh, can you guys see the graphics? Can you still see me? Oh, I don't know. Hopefully you can see the graphic quite well. And so this graphic is showing the classification of the size of fibroids. Okay, so this question really is about how fibroids grow. And I don't want to assume, I know we talk about fibroids a lot, and I have a playlist. I have two playlists. So if you don't know anything about fibroids and you're wanting to learn, I'm happy to keep you busy, because I have 2 playlists, and they have each one I think has more than 30 videos each on fibroids. So please, find some time, sit down, watch, and I know you find them really useful. So the issue is about how the fibroids have progressed. They've increased. Not only have they increased in number, they've also increased in size. So the fibroids are growing. And why is that happening? Most likely under the influence of hormones or other factors. Remember, we don't know exactly what causes fibroids. We know that it's multiple different possible causes, including hormone balance, which might be the biggest issue in terms of estrogen and progesterone imbalance. Of course, the second issue is around the impact on fertility. But before I go on to that, because I just want to address it. Okay, so this question is really interesting, because she talked a lot about sizes. First of all, let me ask you guys, what is the average size of the womb? Before we talk about the fibroid, what is the average size of the womb? Is anybody going to answer me? I don't know if I've got anybody. Can't see anybody here on YouTube here, but you guys on TikTok, if anybody is interested in sharing their thoughts, and when I say womb, let me clarify. So a healthy young female in her reproductive years, non-pregnant, what is the average size of the womb? What do you think? If I asked you the size, things like the ears, the eyes, you can see and you can tell the size of those different organs. Even the heart, you can tell the size of the heart. You might have seen it in pictures. What is the average size of the womb? Okay, so let me make sure that you guys can see. Let me take this off so that you guys can see me. Okay, so the average size of the womb, and I'm so sorry because I didn't think about this before, but I do have a video. Let me take it away from my face. Okay. I do have a video. Yeah, I think you can see this okay here. Guys on TikTok, this is what I'm showing everybody. So this is an apple. Okay. Well, average size, okay, around 7 cm long. Let me not put it in front of my face. 7 cm long, okay, and 4 cm across. Guys on TikTok. Okay. So the average size of the womb. Now, usually we say is a pear-shaped size. So this is not very good. I'm using an apple here, but I don't have a pear at home today. So I'm sorry. But I do have a model here. And this is my model. Just arrived not too long ago. And you're going to be seeing this model. I don't know if you guys can see this properly. It's not showing properly here. Guys on TikTok, here it is. Okay. but I don't know how well you guys can see this. It's not showing as well as I can. Let me ditch the model, but it's going to be showing up in videos coming soon on the channel, so look out for my model that shows the womb, and I'm really in love with it and showing how things work. But yeah, it's of average size of the womb. It's pear shaped, so it's like an upside down pear, so you have the larger base of upwards, and then sort of gently narrows down into the vagina. And like I said, I do have videos on, you know what, I think if I remove this thing at the back, because I want to make sure, I've just got you guys are going to know my secret now, so you know that I've been using a virtual background. Yeah. So that's what it is. But yeah, I want you guys to see this. So let me see if the model will show properly. So hopefully it will show better here. Okay, so that's the model. And I'm just putting the apple in front of, the womb. So that's how it would sit. Okay, this is not a pear. I'm just showing this for demonstration's sake. Okay, so the ovaries on either side, the yellow bits, and you can see the vagina. And I hope you can see this. Okay, anyway, so this is just to give you an idea in terms of size. I'm going to go back to, I like my virtual background. I was feeling really cool to be in that surrounding. So guys, give me a second. Let me go back to that. I really enjoy this. All right. So this is the womb. And we've said is about 7 centimeter by 4 centimeter. What is the size of a 1 centimeter fibroid? Okay, 1 centimeter fibroid. I'm holding up a grape. Guys on TikTok, I'm holding up a grape. Okay, so this is the womb. We said that's the womb. Okay, so this is how a 1 centimeter fibroid could look. And I just want us to be, sort of aware. Something is happening with my light. Okay, so I'm just going to take off this virtual thing until we finish this one, because I really want people to appreciate this properly. So the only point I'm trying to make is in terms of size. If you have an organ that's already this small and then you have a 1 centimeter fibroid, sometimes we say, small fibroids, but small fibroids could have impact depending on where they're sitting. And I've got an image that I'll share with you guys soon that looks at, how the location of the fibroid can be important regardless of the size, because you're already starting with a pretty small womb. So that is the size, so I shared this as usually the size of the womb, a little bit smaller than this actually, size of my hand. I'm tall, so my hands are larger than most, but size of the womb. And here is a 1 or just about, this is slightly over 1 centimeter fibroid. So when somebody says they have a 1 centimeter fibroid, and a 1 centimeter fibroid is a small fibroid, okay? Small fibroid. Let's take that up a little bit and talk about the next stage up. Okay, now she said her fibroid grew to 4.7. I'll look at the question in a bit. So here I exposed to you exhibit number 2. Okay, this is under 6 centimeters. So this is my little satsuma or tangerine, and this is just under 6 centimeters. So imagine this. In this, that's what I want you to capture in terms of fibroids and how they could, be in the womb. Okay, guys on TikTok, this is what we're saying. So we're saying that this is just under 6 centimeters. So this is sort of like a moderate size fibroid. And I want you to think about how that will look in the womb. Okay, this is what we're dealing with. Let me take you one further. Okay, don't forget this is the womb. Don't forget this is let me just take you one further. This is about between 7 and 8 centimeters, my orange. Okay, this is a large fibroid. And many of you will know that fibroids can grow to even bigger sizes than this. And think about the impact on the womb, how it stretches out the womb. Guys, TikTok, this is what we're dealing with. So I'm saying this is more than 7 centimeters. Okay, and potential impact on the womb. And if we're to use the model, which I'm not saying the model is exactly to size, but think about the impact of these fibroids and growths that can completely change the architecture of the womb. And I thought that was really important for us to see, because this question really took us into sizes. Let me just pull it up again. Is it that one? Yeah. This question pulled us up into sizes. So just to refresh our minds, after 2 years, she has 4 fibroids. The size of one of them is 5 centimeters. So the size of one of them is 5 centimeters. So that means this is the size of one of them that she's dealing with at the moment. Okay. And you saw it as it compared with the womb. So you can see it's, this is pretty much, well, I wouldn't say it's exactly half, but at least a third of the womb size, or a bit bigger than that actually, is what she's dealing with. And then she has 2 others. One is 2 cm, the other is 1 cm. They're outside the womb. What can I do? So those are the kind of, so think about the possible impact. It's not going to let the womb function properly. So this kind of person, depending on where it's located, will have different symptoms, heavy bleeding, irregular periods, pelvic pain, pushing on the bladder, for example, causing back pain by pushing on organs, pushing against the womb, might be pressing on the nerves, causing all sorts of different discomfort that somebody with fibroids can experience. But of course, what she also said that was of interest is that it's outside the womb. So let us quickly look at fibroid types by way of their location. So, and guys on TikTok, again, sorry I can't share the image with you, but I'm just sharing with everybody else the different locations of the fibroid. So you could have the submucosal fibroid that juts into the lining of the womb. So it sits somewhere within the muscle, but it's pushing, if you can see my model here, it's pushing into the cavity of the womb. That's a submucosal. Then you have the intramural one that sort of sits within the muscle. It just sits, all of them are coming from the muscle, because fibroid is a benign muscle growth, isn't it? But the intramural one sits within the muscle, it doesn't go in, doesn't go out, just sort of sits there. But it depends on how big it can push. If it stretches and goes bigger, it can distort that muscle. And then, of course, you have the subserosal, the third type, which is sitting in the muscle, but then grows outwards, not into the cavity, but grows out of the cavity. So those are the different types. She said that her fibroids are outside the womb. I can only think that she's saying that the fibroids are subserosal. It's the way I would think about it, because those are the ones that are outside the womb, subserosal. Now, the other thing I think is really important to address is the issue of the impact of fibroids on fertility. Early last year or so, I had my colleague, Dr. Tolu, who's a gynecologist, who came to join us on the channel. We were doing, I think we're doing a 30-day deep dive into fibroids, and spoke to us about fibroids, fertility, and so on. And it's not all fibroids that can affect fertility. And you know this because there are many women who don't even know they have fibroids. They do, but it doesn't affect them in any way. They have no symptoms, and they're able to go on and get pregnant, have their babies, no problems. So it's not always that because fibroids are present, it automatically equates to infertility, because somebody could have fibroids, still have infertility for other reasons. And that's why it's so important not to make that assumption, and why you need an assessment by your clinician, by your gynecologist, your specialist, to look into fertility issues for both yourself and your partner and establish what is the cause, because it may not be the fibroids. I'm not saying it isn't categorically, because I don't know, but it does need exploration. The fact that the fibroids are outside the womb, you would say it's probably not going to affect the womb lining, fair enough, but could they be pressing? Could they be pressing? For guys on TikTok, could they be, sort of pushing somewhere near the entrance of the womb, near the cervix? Could that be where it's located? Could it be somewhere close to where the fallopian tube gets into the body of the womb here at the top, and so prevents the egg from traveling, even though it's outside, but because it's grown, it's sort of putting a bit of pressure and tightening the tissue, because those tissues are tiny. You saw the size of the womb. That's why I brought this here actually, so that we could see what size that we're dealing with. So it's not a huge organ. Okay. So is that a possibility? Those are the kind of questions that I think are really important for somebody to be clear around. So good to assess fertility. Yes, the fibroid can still affect possibility of getting pregnant depends on their location, depends on their size relative to the rest of the womb, the fallopian tube, and so on. So need to speak to a specialist, need for further tests, more than, pelvic scan. She might need an MRI, she might need, different other investigations, blood tests to look at her hormone levels, her partner, semen fluid, semen analysis, and so on, to determine what is responsible. She said she's been trying to get pregnant for 3 years. So already there's a lot of emotional strain, a lot of, really, there's a lot of pain, already, and she's undergoing a lot of stress, herself and her partner, I would presume. And so this is someone that will need a lot of support. So that's what I would say in response to this. I wouldn't just immediately automatically assume that it's the fibroids. And what she should do is she should be under the care of a specialist, because she's got a fertility issue, she's got fibroids. She should be under the care of a specialist. Here in the UK, this is someone that will be referring to the hospital secondary care to look into the causes and the issues that she's experiencing. Other factors into that, her age, or any previous medical problems, of course, her partner, and so on. So I think she should be sitting down with her doctor, look at the problems. These are my concerns, not getting pregnant, and so on. Have the whole conversation. There's so many things that we could say around this, but the really next thing is to be speaking to her doctor and exploring her options, depending on the things that we've just talked about here. So let me know what you guys think. Anybody who's had a similar experience, I'm really interested in that. One of the things I love about my channel is I get a lot of ladies who just pop in and share advice or share experience. I think I prefer experience, because I don't recommend giving advice to people, especially when it's medical, because they're not the same. You could say, oh, I did this and that and it worked for me. And that's fine, because you're sharing your experience. Before anybody else rushes in to try that, make sure that this is good for your health, especially if it's not just medication, even herbal supplements or a procedure. Make sure it doesn't go against your own health. Make sure it's something that would work, for you. Get advice before you embark. Don't just think that because somebody told you here that it worked, then it should work for you as well. So if you've had something similar, please let us know. Drop a comment in the chat. And yeah, that's dealt with that question. Thank you guys so much. If you're just joining, I really appreciate you. If you've been watching for a while, you're a true star. A true star. Thank you. I really appreciate that. Whichever the case may be, don't forget to give the video a like if you haven't done it already, and of course subscribe to the channel. One quick break while I catch up with you guys on TikTok, and I shall be with you. Okay, we're back. So let's deal with the next question. Thank you so much for watching, guys. Let's pull up the next question. And this is on endometriosis. Right. So I beg your pardon. So this is on endometriosis. It's our last question as well. How long have you been doing this? When did we start? I think we started about 11. We started late, didn't we? About 11:20 or so, nearly an hour. Okay, we'll be rounding up soon, guys. This is the last question. I have stage 4 endometriosis, and surgery helped lighten up my severe pain. This really touched me. This really touched me, because women go through a lot. And I don't mean men don't go through a lot. I just think there's a lot here. Everybody can go through different things, but just hearing the story, I just heaved a sigh, because I thought, wow. I have stage 4 endometriosis. Surgery helped lighten up my severe pain for about 6 months. Pain meds, birth control, cleaner diet doesn't help at all. You guys, don't shoot the messenger. This is what this individual is saying. And I say this on my channel because a lot of people will come on and say, oh, cut off sugar, cut off this, cut off that. I have no problem with cutting out sugar. That's not where I'm going. what I'm going to is assuming that a diet alone is going to make a difference. Now, for some people, it might make a significant difference for your condition. I agree. Some herbal treatments can make a significant difference to your condition, but it may not apply to everybody. And I think we should show grace to everyone and not judge or not try to force something down because, oh, it's worked for me, so it must work for everybody. And of course, there is the angst about big pharma and what drugs and their side effects are potentially doing versus natural treatments. That's a whole other conversation. But the point I'm trying to make here is that sometimes a cleaner diet, while it is good, it is recommended, may not be enough. And many times it's not enough to solve the problem. So it's not me, it's somebody. In fact, well, it's nothing wrong if it's me. I mean, that is my position, but somebody else is saying from their experience, they've tried the pain meds, birth control, cleaner diet, doesn't help at all. The endometriosis has spread to other organs, and I just don't know what more I can do, with a very sad emoji face. That's what we're dealing with today. So I'm just going to share, I think that's the last slide to share. And I'm sorry if it's not very clear, guys, on YouTube, Facebook, and LinkedIn, but I'm just going to read it out. Guys, on TikTok, we're just showing a graphic with the stages of endometriosis. So we go from stage 1 to 4. And again, I have a playlist on endometriosis, another one of those common women's health conditions. Diagnosis traditionally not very good in even different parts of the world, but here in the UK, figures suggest it can take 7 to 8 years for some women to be diagnosed with endometriosis because, different reasons. One of them, unfortunately, is medical gaslighting. That is symptoms not being taken seriously by the doctor. And I've talked about that on the channel as well, but also the nature of the way it presents. Sometimes it might be with irregular periods, which some people say, oh, women have irregular periods and they don't take it seriously. But yeah, I don't want to digress. But endometriosis, when tissue, which normally is within the lining of the womb. So guys on TikTok, so that sort of pink, where's my pen? So that pink, this pink, light pink, fleshy bit, the bright red is the muscle, okay? But this pink one, that's the inner part of the womb cavity, the lining. So that tissue now goes in other parts of the body, including the womb itself. So it might turn up in the muscle, it might turn up in the ovary, it might turn up in the vagina. That tissue doesn't belong anywhere else but inside the womb. Sorry, guys, on YouTube, Facebook, and everywhere else. Sorry. So I was just trying to demonstrate that when we're talking about endometriosis, I'm just covering my face, aren't I? I don't know how to position this. Okay. I hope you can see. Let me bring it closer. So this is the inside of the womb. Okay, so that's the lining in this flesh-colored or light creamy pink. The bright red is the muscle. So all this red that you can see here, that's the muscle of the womb. But inside here, that's the lining. It's special tissue. Okay, don't forget that that's the tissue. That's the area that supports the baby. It's special tissue. And it's not the same as the muscle tissue or even the outer layer on the womb. So endometriosis is what happens when that special tissue that makes up the womb's inner lining is found elsewhere. That's endometriosis. And that elsewhere is so critical because it can be in different parts of the body, including the womb. And so the image I'm showing you here, those spots that you're seeing, those dark spots that you're seeing is how we stage endometriosis depending on where the endometriosis tissue is found, how severe or how extensive it is, and so on. So for stage 1, there's few superficial tissue implants. And when this tissue, one of the problems, when this tissue migrates or finds itself outside the womb, inflammation happens because this tissue, don't forget, is menstruating tissue. It's responsive to hormones. So it may be in the muscle. Your muscle it's not the muscle of the womb that's bleeding. It's the inner lining that's bleeding during the cycle. So if it's the time of the period, that tissue that's either in the ovary that's not supposed to be there, or in the muscle of the womb that's not supposed to be there, or in the vagina that's not supposed to be there, or maybe in the pelvis that is outside the womb, in the pelvis on the bladder is not supposed to be there, it will become, it will bleed during menstruation, and it will cause problems. It can cause pain. It can cause scarring. That is scar tissue. Like if you have a cut and it heals, the tough tissue. Imagine that developing inside the organs. So that can cause scars, and it can cause adhesions where the tissues get stuck together, and it's tissues that are stuck together. Apart from causing pain, they won't function normally. If you have an adhesion, for example, that develops as the fallopian tube juts into the womb, the egg can't pass. So those are the kind of problems that endometriosis, the tissue, can cause. Okay, so just going back to this diagram, like I said, the different spots tell you where they are located, how much. So the first stage is few. Stage 2 on the right, slightly deeper. You can see that the black spots are a bit bigger, and it's slightly deeper within around the womb architecture itself. And then stage 3, you have deeper implants. You can see that you have a lot more going into the tissue, and then you start having them forming in the ovary. And they're called chocolate cysts when that happens in the ovary. But again, as that happens, you have inflammation. They bleed into the ovarian tissue where you're not supposed to have any bleeding. They cause scars in the ovarian tissue. And so we're talking about why somebody can develop infertility, because the ovary is just not working properly wherever those endometrial tissues are found. And finally, stage 4, where you have deep implants, larger cysts in the ovary, many adhesions, and those are the strips that you can see traveling from the ovary towards the rest of the body of the womb, causing more scarring. So that's really more severe disease. So just to put you in context of what this last question of ours is around. So she has severe endometriosis. Treatment was attempted with pain medicines, birth control, cleaner diet. It didn't work. And she's, feeling very frustrated. And, I'm tired, frustrated. It's not just about period pain. This is something that impacts the entire body, both physical and mental, can affect relationships because she'll be having pelvic pain. Having sex could be painful as well. Having periods will be painful. It could affect her fertility. So for some, like she said, surgery might be useful, but it doesn't always provide long-term relief because it might come back. And if the routine pain meds, for example, we use painkillers like ibuprofen or stronger anti-inflammatory drugs can be used. Even birth control can also be used. Different types, the pill, the implant, we can use those to try to control the pain, especially if somebody is not about to have a family, if that's not the immediate goal. Those are some of the measures that we use. But if all that's failed, then it means that we have to look at other considerations, other ways to manage pain. Maybe a specialist pain doctor, some types of pelvic specific physiotherapy for the pelvis, not general physio, tailored to the pelvic area, and other hormone treatments. I think the key thing is to say that, endometriosis can be such a complex condition, and I'm glad that there's increasing awareness for us to understand how women struggle with this condition. And it's not just one thing that you're dealing with. It's not just, just sort out her period pain. The disease can continue progressing if you're not aware what you're dealing with, and be mindful of its potential complications. So apart from simple pain medicines, these endometrial deposits, like I showed you on the screen, they could affect nerve tissue. So sometimes it might be nerve pain or medicines for nerve pain that could be useful. This is something that you might want to have a conversation with your doctor. So please, let them explore other types of pain. In earlier stages of endometriosis, before it gets to stage 4, pain may be more cyclical, associated with the period, because that's when the endometrial tissue will bleed. But as you get into stage 3, and particularly in stage 4, it's no longer every cycle. It's constant pain, because not only has there been chronic inflammation going on, we've talked about scars, we've talked about adhesions where the tissues are jammed together, they're just not functioning, nerves are inflamed. It's really, really a nasty kind of thing. And this chronic pain can also lead to pelvic floor dysfunction. I have a video on the channel. I talk about the pelvic floor, how it works, the conditions that could affect the pelvic floor. And I think it's useful to watch. If you're interested on the subject, go to my YouTube channel to have a look at that pelvic pain video. But, this can contribute from all this business with the endometriosis going on in the womb and the surrounding tissues, can affect the pelvic floor, which is that sheet of tissue that is holding up the womb, the bladder and the rectum, and the pelvic floor just becomes tight. Its muscle becomes tight. It doesn't respond normally, just making things worse, affecting sex, affecting urination, even using the toilet. So it can be quite complicated. So we talk about endometriosis that spreads to other organs, and that's known as deep infiltrating endometriosis, which is what I strongly suspect, I beg your pardon, is happening here. And that might include the bladder, in which case, just like I said now, you might have pain passing urine, might develop frequent urinary infections, or even experience blood in the urine. If it's spread to other organs like the bowel, it might cause constipation or diarrhea on the other hand, or bleeding when you're going to the toilet, or pain when you're going to the toilet. They are very rare organs that endometriosis can affect, but we learn about long endometriosis. So somebody is coughing up blood during their menstrual period or feeling short of breath. They're rarer, but it's possible that it could happen. And of course, I've said more than once about the effects of organs sticking together. So imagine if the bladder now gets stuck to the womb, or the womb now gets stuck to the rectum behind. That again can cause problems, pain, problems using digestion, and the free flow of material through the body. Of course, let's leave the other organs. Let's come back to the sort of the focus, which is gynecological issues and fertility, because simply having endometriosis can affect the egg quality, affect the ovarian function. There's something about the inflammatory matrix within the body for somebody who has endometriosis, in addition to the fact that having tissue in places like the ovary or the fallopian tube can affect how those organs function and affect fertility. So it can affect the quality of the eggs, lead to reduced ovarian reserve, can lead to blocked fallopian tubes. Again, from scars, I've shown you on my model how that could happen. If the endometrial tissue is sort of sitting, sort of close to where the fallopian tube enters into the body of the womb. So those are some of the challenges, and sometimes even with assisted reproduction, it may be difficult or quite challenging to conceive. And I'm just trying to put us in the mind of this person who sent in this question. Other issues are mental health, emotional struggles, feeling depressed because of chronic pain, not being able to function at work or school, as the case may be. I mentioned medical gaslighting at the beginning. It's a big issue. And I really talk about women advocating for themselves. And one of the ways that you can get into that position is by learning, find evidence-based information, get a second opinion. If your doctor, who's supposed to be your advocate, is not listening or taking you seriously, that's not a good doctor. That's not good enough. You deserve more than that. Of course, emotional struggles at home, affecting relationship, and just the stress of feeling alone or isolated. But this is not a condition that is rare. Lots of women experience this. I think the positive thing is that there is a wider conversation. There's more and more conversation around this, I think, to help women. Now, the question was, well, if you can call it a question, she just said she doesn't know what else to do. And, I put it there, even though it wasn't a specific advise me kind of question, I put it there to highlight the problem. She said, endo has spread to other organs. And I've shown you guys, I've just described how it could spread to other organs. And she says, I just don't know what more I can do. And this speaks to me, someone who needs a lot of support, both personally and from her medical team, if possible, and they're willing, the involvement of a therapist or a counselor. Surgery isn't always the cure. Even though she had some benefit for about 6 months, as she told us, it's possible for it to come back. And that can be so frustrating, so painful and frustrating, thinking about all you did to prepare for surgery. And then, you know, you had it and you thought, right, sorted, and then, you know, it's back again. So painful. There are medication side effects to deal with. We talked about pain medicines. There are also hormonal medicines, quite some strong hormone medicines that we use to treat endometriosis symptoms, because we don't have a cure for the condition. We just have medicines that can try to treat the symptoms, and they include things like birth control I'd mentioned, but even other types of hormone medicines that can tip the balance or try to change the balance of hormones in this condition, and they also come with their own side effects. Of course, the other issues are, you know, sort of related to that. It might be, you know, the cost of everything, the cost of time out away from work, the cost of, apart from the cost of time away from work, even the cost that you spend trying to get all these opinions, you know, trying to find help, trying to see the doctor, trying to book for one thing or the other, different treatments that you might have to have. Depending on where you are around the world and how your health service is structured, you might be paying a lot of this, not just insurance and so on. It's a lot. I think, having looked at everything that one has to go through with that, I really think it's important to have an open conversation with your doctor. What are the small wins that we can have? It's a difficult situation. What are the options? What are the small wins? What are the big wins? Is there any treatment that we've not tried? Can we go on this, you know, to find some way forward? So I would really recommend doing that. If it's not something you've done before, please don't give up. It's not just that one is an ever optimist, but, you know, we have to be hopeful. We have to be hopeful. And I really extend my, you know, my thoughts and regards to this person. I just hope that she can find the support to take it one step at a time, because we don't always find the answer when we try the first, second, even third or fourth time. And we're human, we get exhausted. And sometimes it's just having somebody to support you, somebody to say, I understand, let me help you, to help them get from one step to the other. So that's what I would say. But I would love to know what you guys think. Let me know what you guys think. Is there anything else that possibly you've had this experience and, you know, your doctor did something different? There was a different way that they looked at it. Again, I think it's really great to share experience. You know, women supporting women, as the term goes. But seriously, you know, hearing others' experience can also help to build confidence, you know, help to provide direction. It may not necessarily work for you in the way that it worked for them, but it can help to open up a conversation with the person that you need to speak to. Guys, thank you so much for being part of the stream today. It's been great talking with you. We're back here next Sunday. It's usually on Sunday evening. I try to do this between 7 and 8 on a Sunday evening GMT, because I'm based in the UK, and because of the special circumstances of yesterday. It didn't happen yesterday, so it's happening this morning. But it's really great talking to you guys, and I appreciate the time that you've spent with me. Please don't forget to give this video a like, and of course subscribe to the channel, and check out all the other things that we have both on our website and the different platforms, especially here on YouTube and TikTok, LinkedIn, and Facebook. So thank you. Have a great rest of your week, and I will see you again soon. Bye bye, guys.
Hi, I'm Dr. Sylvia. I'm so excited you're here. In this video, you'll get excellent health tips that will make a real difference. But that's not all. I also create personalized guides, tools, and plans tailored to your specific needs. These resources will help you reach your goals faster and more effectively. Don't miss out on your free copies. Check out the links in the description box below. Before you watch this video, please like and subscribe to the channel so we can continue this health journey together. So, let's get started. I'll see you in the rest of the video.